You're in 11:30 concurrent session, HIV then and now. So each presenter will have about 15 to 20 minutes to present, and I'll be brutal and I'll wave things at you to keep you on track. Before I start, I'm going to quickly read the bios for each presenter. And how things going to work is presenters going to come and present during their presentation. And at the end, we're going to take questions, and all the presenters going to come sit at the panel. Okay. Yeah? Great. So Mark Gaspar. So I'm a little bit tired. I had a couple hours of sleep. So if I say things in a weird way, please excuse me. Mark Gaspar, is that how you say it? Yeah. Yep. From University of Toronto. Dr. Mark Gaspar is a postdoc research fellow at the Dalai Lama School of Public Health, working with Dr. Daniel Grace on ENGAGE, Gay Men's Mental Health Qualitative Sub-Study, and the HPV-SAVE, HPV and Anal Cancer Screening Qualitative Sub-Study. Gaspar completed his doctoral work at Concordia University in Montreal in an interdisciplinary program with a focus on sociological research, qualitative methods, critical social theory, HIV and AIDS, sexuality, and working with vulnerable populations. He is also a two-time fellow of the University Without Walls program, a training program for the next generation of HIV/AIDS researchers in Canada. Gaspar's doctoral work involved conducting in-depth qualitative interviews with 33 HIV-negative gay men living in Toronto and Montreal to understand their experiences related to managing HIV serostatus uncertainty. Another presenter, Kiffer from Simon Fraser University and BC Center for Excellence. Kiffer is a doctoral fellow on the Momentum and Engage studies. Currently, he is completing his dissertation at SFU. His current research focuses primarily on how social influences shape our behaviors and well-being, and the impact these influences have on contemporary epidemics and disparities. Ben Klassen? Ben Klassen? Great. From Simon Fraser University and also BC Center for Excellence. Ben is a master's student in the Department of History at SFU, where he studies the early years of Vancouver's HIV/AIDS epidemic. He's the project coordinator on the HIV in My Day study and was formerly a research assistant at the Momentum Health Study and a volunteer at Community and Health Initiative for Men. Terry Howard, GlassHouse consultant. Terry is responsible for facilitating the promotion and development of HIV CBR within BC's HIV service and support agency community, and has worked with people living in HIV/AIDS for over 25 years. Currently, a major focus of Terry's work is developing standards of support and training for peer researchers throughout the province of BC. And with the greater national HIV research community, sorry about that, recent research projects that Terry has conducted as a principal knowledge user has been PRA Plus, a PRA mentor training project, and currently as a co-investigator on the ENGAGE study in gay men's health. Julio Galarz. Julio is an HIV survivor, having been diagnosed with full-blown AIDS in 2010. Prior to his diagnosis, Julio worked as a manager for Starbucks Coffee. He is part of the transgender community, having participated in the Calgary Pride Parade for the past several years. He is one of the developers of the Plus Friends, a Calgary-based HIV peer support group founded in 2013. He has been both a peer navigator and a facilitator, bridging his experience from the Southern Alberta Pain Clinic to bear in this process. Julio is a fitness advocate and has worked tirelessly to improve his overall health and self-esteem. Julio has a green thumb and enjoys gardening. He supports gay and transgender rights and the goal of equality and reduction of stigma for HIV individuals. Patricia Miller from Montreal University. Patricia Miller is a registered social worker, psychologist in private practice. She is a professor at Mount Royal University. Her original PhD research was focused on participatory action research project for serodiscordant couples living in HIV. In her original research, the community of couples decided that they wanted a lived experience support group. This manifested into a fully funded peer support group called Plus Friends Calgary that is now supported through HIV Community Link. She was asked to keynote about this research project at the International STI, STD, HIV AIDS conference in Vancouver 2017. She will also be keynoting in Montreal and Las Vegas in 2018 about the value of peer support in relation to trauma-focused care, capacity building, and reducing social stigma. So these are all presenters. And Dr. Mark Gaspar will present.
Thank you. Thank you all for being here. So I'm presenting some work from the HPV-SAVE. Can you hear me? It's good? Yeah, okay. I'm presenting some work from the HPV-SAVE project, which I'll describe a bit more thoroughly in a moment. And there are a few other authors on this project, including Daniel Grace, who's right over there. So if you have any hard questions, you could direct it that way. So the outline for this presentation is first, I'm going to give a background on HPV vaccine research. And then I'm going to go through the methods of our project. And then I'll describe the results, and then I'll have a bit of a discussion. So HPV and cancer, some of this might be a little bit old for you. You might already know it, and some of it might be new, so I'll go through it. So HPV, or human papillomavirus, is quite pervasive. And I'll show some charts in a moment that will demonstrate that. It's the cause of cervical cancer, penile cancer, anal cancer, and head and neck cancers in both men and women. And we've noticed some high anal cancer rates amongst HIV-positive gay men, and I'll explain that in a moment. So this is a chart, and I took this from Dr. Ann Burchell. I'm not really a chart person, but people take you more seriously when you have figures. So this is from Dr. Burchell, and this is from a study that was done in Brazil, Mexico, and Florida with almost, actually, 2,589 men, both straight and gay. And amongst men who have sex with men, this shows the prevalence of having one strain of HPV. So if we look at age 25 to 34, we see that in the genital tract, about 70% of the men had HPV, and in the anal tract, almost 60. So this is just demonstrating how pervasive it is, especially amongst that group. In general, we find that it's higher in the genital tract than in the anal canal, except amongst 18 to 24-year-olds, which I noticed this morning. And I'm like, is this because younger guys are more bottoms or what? But actually, it translocates. So even though it might be found in the genital region, it could actually move to the anal canal. I'm just going to press this. So what this shows is at the bottom, anal cancer is actually higher in the general population among women and not among men. But when you add HIV to the mix, first it goes HIV-positive women, then HIV-positive men, and then HIV-positive MSM, or gay men. And so we see amongst HIV-positive gay men a 30 to 100-fold increase of anal cancer. It's still, compared to the general population. It's still a very rare cancer, but if left untreated, it could be quite problematic and deadly. So, as many of you already know, there is a vaccine available, and there are two versions of the vaccine. There's the regular quadrivalent. It's quadrivalent because it protects against 4 strains, 6, 11, 16, and 18. 6 and 11 protect against wart-causing HPV, and 16 and 18 prevent against oncogenic strains of HPV, which means cancer-causing strains. There's Gardasil 9, which is the non-valent Gardasil, and it has additional strains that it protects. Those are also oncogenic, but for anal cancer, particularly among men, it's really 16 and 18 that are the most serious. The other strains are they tend to affect women more in the context of cervical cancer. So that could be something important for service providers if you're thinking about what vaccine to recommend for gay men. Because there is a difference in cost. The quadrivalent is about $450. You take 3 doses at about $150 a dose. And the nonavalent is about $540 with $180 for 3 doses. And then at the bottom, I have a list of side effects, which are the very stereotypical side effects that you get from everything from Tylenol to Advil. So I have a timeline of how Gardasil was approved and how coverage has changed in Ontario. This study that we're doing, that I'm going to explain a bit more in a moment, is also taking place in Vancouver, but the data I'm presenting is all from Toronto, so I'm focusing on Ontario. So in 2006, Health Canada approved Gardasil 4, the quadrivalent for girls and women aged 6 to 26. In 2007, it offered coverage for girls aged 9 to 13, so they're vaccinated in elementary school. For free. In 2010, Health Canada approval expanded to boys and men aged 6 to 26. In 2015, Gardasil 9 was finally approved, but it's not covered by and still isn't covered by provincial insurance. In 2016, Ontario first offered coverage for boys aged 9 to 13, and then later in the summer for gay men and MSM up to the age of 26. So vaccine efficacy. So the research has shown us that the vaccine is very beneficial at preventing anal precancers amongst gay men. I'm just going to use the term gay men for most of this presentation because you'll see in a moment most of the guys identified as gay men, so instead of using MSM, I'm just going to focus on gay men. But this obviously applies to a broader range, including bisexual guys. So the vaccine is beneficial in preventing anal cancer precursors among GB-MSN up to age 26. It's safe and effective in HIV-positive males. And the last thing shows that there's persistent memory. So even when guys were tested, HIV-positive guys were tested 2 years later, they still showed antibodies for HPV. 2 questions remain, though, is what if you're older? So one question remains, what if you're older than 26? Is the vaccine still effective? And there have been 2 studies that suggest yes. So one study done by a member of our team, Troy Grennan, showed in Canada, they looked at a bunch of HIV-positive MSM, and they found high prevalence of HPV in that group, but no individual had all 9 strains of the HPV, which means that it's likely that we all have one version of the HPV virus within us, but we don't know which one it is, and we don't know if it's the oncogenic one, so it's probably to our benefit to actually get vaccinated. The second study showed that amongst MSM who had gone treatment for anal cancer precursors or anal dysplasia, those who were vaccinated had a 50% reduction in anal precancer reoccurring after that treatment. So research on vaccine uptake in gay men. So this research has largely been quantitative. And it's generally shown a limited awareness of HPV, a limited awareness of HPV's cancer risk for gay men. So there was an Ottawa-based study that showed that 77% of the 278 participants were aware of the vaccine, but only 16.2 had been vaccinated. And again, I'm taking from Ann Burchell. These are some data that are coming out of the quantitative arm of the same study, the HPV SAFE study. And they found that, and this is a particularly striking number, 45% of the 678 HIV-positive gay men that were surveyed had either not heard of HPV or did not know what it meant. That means about 50% had no idea what it was or what its implications were. Only 63% had heard of the HPV vaccine. 19% thought their chance of getting HPV was 0, and 36% thought their chance of getting HPV was low. So clearly there's a kind of knowledge gap or a sense that it might not necessarily be urgent or relevant for men and gay men. Qualitative research has kind of noted the same thing. Gay men are willing to be vaccinated once they hear about the vaccination, but they actually have limited awareness about the cancer risks associated with HPV. And physician recommendations have been highly associated with vaccine uptake. Some barriers to vaccination. And I'm going to go into these in more detail when we go through our data from the project. But again, limited awareness of the HPV vaccine, the gendered associations with HPV, so people thinking it mostly affects women, the cost of the vaccination, concern with side effects, stigmatization, so some data has looked at how some guys are afraid that if they ask for the vaccine, it's going to communicate to their physicians that they're a bottom, or that they're having gay sex in a broader group of MSM, and uncertainty over the vaccine's effectiveness. So our study. So what we wanted to do with the qualitative study was add to the limited qualitative research in the Canadian context on HPV vaccination. We wanted to understand HIV-positive gay men's knowledge, attitudes, and behaviors related to the uptake of HPV vaccine, and we wanted to assess any barriers to vaccination. And I'll explain the study as I get to the methods. So what we did specifically for what I'm presenting today is 25 in-depth, semi-structured qualitative interviews with gay men living with HIV in Toronto. And these guys were recruited through the HPV-Safe clinical study. So what this study was a study to test for anal cancer and anal cancer precursors. So guys were recruited through their primary care physicians and underwent an anal pap, kind of like what women do for cervical cancer screening. They underwent an anal pap, and if the results were abnormal, they were invited to go in further through the study and to receive another pap test and to receive a biopsy. And if that demonstrated the potential for anal cancer precursors, they were then asked to move on further in the study, and they either had that precancer monitored or that precancer removed in treatment. And so our task was to interview guys throughout this process, so guys who had the anal pap but had normal results, guys who had the anal pap had abnormal results, who underwent surgery, who didn't undergo surgery. And the interview length was about 30 minutes to 75 minutes. There was a $30 honorarium, and it was analyzed using grounded theory and in vivo. So the demographics, so we had diversity across age, but skewed a bit higher, so the average was about 50 years old. Most of the guys identified as gay. Ethnicity, it skewed largely white, with 80% of our sample reporting that they're Caucasian. In terms of vaccination history, prior to joining HPV Safe, so prior to their first anal cancer screening, 6 of the 25 men we interviewed had been vaccinated. That means the bulk hadn't been vaccinated. And then after they had their first anal pap test, 3 participants were vaccinated and told me during the interview. Okay, so now I'm going to do a little bit more reading. So some results. Most of the participants interviewed said that they were aware of the HPV vaccine before entering the HPV Safe study. Some men said that they first became familiar with the vaccine after they were diagnosed with anal genital warts. So a history of warts or an abnormal pap test were the 2 main facilitators to being vaccinated for HPV, because that made them encounter HPV and the cancer risk associated with it. At the time of the interview, only a few participants stated that they had never heard of the HPV vaccine before. However, the majority said that they had not seriously considered or researched the HPV vaccine until after their involvement in the HPV Safe study. Those 6 who had been vaccinated described experiencing no significant side effects. Some of the men interviewed described the positive benefits of vaccination of those 6, stating that their anxieties around anal cancer risk had been substantially reduced. For some of the participants, the decision to be vaccinated was described as being quite straightforward, and this is the first participant above, who stated, "If it's the sole cause of anal cancer, I just can't believe that people would be so stupid not to go and get the vaccine." He was a very opinionated interviewee. It was lots of fun. He also was talking a little bit about fisting, which had nothing to do with the interview, but I was entertained. So overall, most men reported a belief that vaccines in general were safe, effective, and necessary. Some avidly critiqued the resistance to vaccines. So this is the second quote. "I'm a big vaccine person. I get the flu shot. I got the meningitis shot. I got the pneumonia shot. I do all the vaccines, and I don't put up with anti-vaxxers at all." So this was the general sentiment. Like, most people were very pro-vaccine, have a history of being vaccinated. Nobody was really critical or anti-vaccination. Some asked about potential side effects, but they weren't overly concerned. None of our participants reported that the vaccine had been strongly recommended to them by a physician, which is just a little bit funny because we also interviewed physicians. So when you talk to physicians, they say, it's, you know, I bring this up to all my clients, I tell them how important it is, but then you talk to the patients and they're like, my physician has never mentioned it to me. I'm like, okay, so one of you is lying or not. But what it really is it could be mentioned, but if it's not put as a, this is a key priority item, they're kind of like, oh, it's one of the things I heard about, but I thought it was just optional. Despite an emerging sense among many participants that HPV and anal cancer are serious health risks to HIV-positive gay men, many in our sample who had not received the vaccine remained ambivalent or vaccine hesitant about the HPV vaccination. So by vaccine hesitancy, I'm referring to, and I'm borrowing from the World Health Organization, to a delay in acceptance or refusal of vaccines despite availability of vaccination services. So we're focusing today less on the refusal of vaccination, but the actual delay in acceptance of the necessity. So we noted two general things that were facilitating vaccine hesitancy amongst our participants. And the first were the gendered associations of HPV, and I'll explain that in a moment, along with vaccination or health literacy, and the second was cost. So in terms of gender, the association between HPV and women appeared to be a significant factor affecting the vaccine hesitancy of the participants we interviewed. Many men discussed having first heard about Oh, skip something. So this is a quote of one. Oh, I'm like missing a quote. So in this quote, he's talking about how the first time he heard about HPV was in the media, and it was associated with women. And the thing that is actually striking is a quote like this exists in every single one of the interviews. One of the first questions I asked was, when was the first time you encountered HPV? And almost across the board, oh, I heard about it, but it was something to do with women. So it was quite striking how that was in every single narrative. Some participants also noted that they had not considered anal cancer as part of the male-specific cancers that they were knowledgeable of, such as prostate, testicular, and colon cancer. So it's just not something that they thought that men had to deal with. Some participants described that the association between HPV and women made it hard for them to locate health promotion material that was directly relevant to them. So that's the first quote up there. He thought, oh, this was something that just affected women. When he tried to find information, it was more skewed towards women. So he was like, oh, I don't think it affected me. In another case, which is the second quote, a participant discussed encountering HPV-related information in a health booklet he received soon after his HIV diagnosis. This man reported that he did not think about HPV vaccination at the time because he thought it was predominantly a woman's issue and because he was also processing a lot of new information with his HIV diagnosis. And we're working on this in another article we're doing, but how HPV actually competes with all the other health issues that one is learning at the same time. So it's not that people don't care, but just at the moment it's not the key priority, and then you kind of forget about it, or for some of the participants. Okay, some men's vaccine hesitancy was also rooted in uncertainty over whether or not, I'm going to have to speed up, whether or not it remained useful to receive the vaccine now. So in this instance, going back to the information I said before, this guy was unsure if he should be vaccinated because he's like, well, chances are I've been infected with HPV. Is there any point to it? Which, as I said before, there actually is, but this information is not widely available. The other main thing affecting vaccine hesitancy was cost. And so I mentioned the cost can range from $400 to $500, or about $550. So the first participant up here, he was vaccinated and he had insurance to pay for it. But when asked if he didn't have insurance, would it have made a difference? And he said no, he thinks it's really important and something that he prioritizes. The second guy, was also not vaccinated, and he had insurance, but when asked if insurance made a difference, he said, well, no, now that I have more information about it, I think it's one of those things I just want to do, I would do just because it's a safe thing to do. In this example, so this is somebody that was vaccinated after they had received abnormal abnormal results and had insurance to pay for the vaccination. But when asked if he didn't have insurance, would it have made a difference? And he said, after being diagnosed with anal dysplasia, not knowing if the vaccine is going to have any benefit, I don't know. It would depend on the cost. If it's a high cost, then probably not. So this is somebody that would actually be a really good candidate for vaccination, but he's saying, if I didn't have insurance, I don't think I would do it. It would be too expensive. And the bottom is an example of somebody who got the prescription, and then when he went to the pharmacy, he decided to opt out because it was just too expensive for him, and he said, I can't afford it. In these examples, and we have quite a few of examples like the one at top, where we were asking, so how much are you willing to pay? And people would say something around $30, maybe $100. But when you say, how about $400 or $500, they're like, absolutely not. And the bottom one, 1 minute. And the bottom one is somebody critiquing the government, the Ontario government, for being short-sighted, saying they should be covering this because it's a lot cheaper to get vaccination and to pay for somebody's chemotherapy. So discussions and implications. So two primary factors appear to have facilitated the vaccine hesitancy of our participants. So the first were the strong gender dissociations, this idea that it was mostly an issue affecting women, and thus these guys weren't at risk, so they didn't understand why they would have to be vaccinated. And the second was the idea of cost. So even guys who thought that they would be they should be vaccinated, if they didn't have insurance, they said, well, I can't do this because I can't afford it. So we argue that public health policy and health promotion strategies in Ontario have facilitated vaccine hesitancy amongst HIV-positive men at risk for HPV-associated cancers. Improving the uptake of HPV vaccination will require addressing both persistent financial barriers to access as well as increasing HPV health literacy levels, particularly by reframing the long-standing gender dissociations of HPV and emphasizing vaccination as part of a holistic, safer sex or sexual health strategy, or going back to this morning, this idea of thinking about combination therapy or combination prevention. What are the things that have to be working in combination with each other? In the interim, though, strong, clear, unambiguous recommendations for vaccination from primary care physicians will be central for increasing the uptake of HPV vaccination, particularly among gay men older than 26. And just very quickly, some of the limitations are that we only focus on HIV-positive gay men and not HIV-negative men. The sample skewed largely white, and the men we interviewed were largely linked up to care or very engaged in care. So we don't know how this might look like with guys, for instance, who don't have primary care physicians. And these are just my acknowledgements, the funders. Thank you.